And I would like to introduce our first speaker this morning, who's going to kick off the symposium for us with a overview of the neuroimmunologic disorders. This morning and early afternoon session are going to run through the various disorders that fall under this umbrella of these inflammatory disorders that affect the central nervous system. And Dr. David Irani is going to try to pull this all together for us and how they relate to each other.
Thank you for that introduction, Sandy. And let me just take a quick minute to reiterate his and Doug's words of welcome to the symposium. It's really exciting to see all of you here. And the other comment I want to make before I launch into my overview is that one of the things that's really unique about the format to this meeting is with this parallel session. So in the clinical session, we're going to talk about these neuroimmunological disorders. Right next door, clinicians and scientists are talking in great detail about the mechanisms that we're starting to unravel regarding these difficult, complex diseases. And as someone who straddles both sides of the spectrum here, one of the things I want to emphasize with you is that the fact that we've got these parallel tracks is quite unique. Many of us who go to scientific meetings don't have a parallel clinical session. So one of the things I want to ask you guys to think about is, as you are here in the next couple of days and you see people with blue badges who are the faculty speakers, go up to them, talk to them, introduce yourself to them, tell them a little bit about your story, ask them questions about the diseases that you're interested in, and provoke them a little bit. I mean, challenge them to give you answers to the tough questions that we all have about these disorders. And it's that interplay, I think, that makes this a unique format, and hopefully will make it a situation that you get the most out of. So I would encourage you, whether it's in the hallway or at lunch or in a poster session, to go up and meet the people who are talking in the scientific session. The brain power in the room next door is just unbelievable, and the program that's been put together really brings together world's experts in these diseases. And so these are the people who are in the best position to unravel the mysteries of these diseases. So as I said, tell them your story and interact with them. It'll make it a unique experience for them as well. Now, I got to get us back on schedule, Sandy. So I'm going to give an overview, and I only have 12 slides, and in part because I don't want to steal other people's thunder. You're going to hear a lot about these diseases from my colleagues over the course of today, and tomorrow you're going to hear about therapies that we apply. So as I sort of sat down to think about what I might say here, I didn't want to steal anybody's thunder, but I think what I'm going to do is sort of give you a where we've been and where we're going kind of approach. And so here in my list of things I want to cover very quickly, when we first started doing this symposium and talking about these diseases, we were very much focused on descriptions of these diseases, and that's important. As clinicians, we want to sort out who's got what problem and how do we diagnose it. But I think what you're going to learn is that both in the clinical session and to an increasingly greater extent in the scientific session, this is where we've been, and this is the kinds of things of where we're going. So why do people get these diseases? What are the things that make individuals susceptible to these disorders? And then there's a lot of talk next door about the actual mechanisms down at the level of the cells of the nervous system and cells of the immune system. How do these things interact in an abnormal way to cause these diseases? One of the really exciting and explosive areas in this field are the new diagnostic methods. So there's a whole session in the scientific symposium about new imaging techniques that are being developed. And we would be remiss if we didn't start talking about treatments. So at first, our approach really was to try to take a sledgehammer to the immune system, wipe out the immune system to try to help patients get better. And that works, but it comes at a substantial cost in terms of side effects and risks. So one of the really neat things about understanding the mechanisms is we're now making more of a surgical strike, so to speak, on the immune system. So we can selectively target things now from a treatment standpoint that make these treatments more effective and much safer. And I don't think we would even be talking in previous symposia about the concept of preventing these things from happening in the first place. So it gets back to this issue of susceptibility. If we can figure out which population of patients are susceptible, which population of individuals are susceptible to these diseases, we can really, in a realistic manner, talk about what we can do to actually prevent them from happening in the first place. So let me go over the phenomenology quickly, and this may be a message that you've heard before, and in part is the foundation from previous symposium that we've developed to think about these diseases. And one way to think about it are lesions that affect the nervous system, the central nervous system, the brain and the spinal cord, the peripheral nervous system, the nerves and the neuromuscular junctions and the muscles, and lesions that occur over time. So some of these disorders are what we call monophasic in nature, that they occur as one-time isolated events. Optic neuritis is an example, transverse myelitis is an example, and it affects one part of the nervous system, in the case of transverse myelitis in the spinal cord, but not in the brain. Then there are diseases that occur predominantly as one-time events, but affect multiple different parts of the nervous system simultaneously. And acute disseminated encephalomyelitis, or ADEM, is a good example of that. Lesions that can develop in both the brain and the spinal cord at the same time. Then, of course, there are the diseases that have a longitudinal course in terms of episodes coming and going at different points of time. Multiple sclerosis is the prototype example of that, where it can affect multiple different areas of the nervous system sequentially. So it can attack the spinal cord at one stage, remit, come back and attack the optic nerves at another stage of disease. And why does that happen in multiple sclerosis, where symptoms come and go, and happens to a much lesser degree in these diseases? We don't understand that very well, but those are the kinds of things that we're trying to figure out. And then there are patients who've had transverse myelitis that have had relapses. It's a small subset of patients with transverse myelitis that have recurrences, but is recurrent transverse myelitis different from monophasic transverse myelitis? And why is that? So these are sort of the way we categorize many of these diseases. And this is the kind of thing that we spent time thinking about and talking about in previous symposia. So one of the things that I think is new or increasingly paid attention to is the susceptibility to these diseases. And there are at least 2 talks in the scientific session, they may have already happened by this point, about genetic susceptibility. And we now have the whole human genome sequenced, and we can do genome-wide scans to look for genes that predispose individuals to coming down with these diseases, and this is a microarray example of that. But we're now learning that some people are genetically more susceptible to getting autoimmune diseases than other people. And if we can figure out how and why, that will be a big leg up in terms of thinking about the possibility of preventing these diseases from happening in the first place. So genetics is playing an increasingly important role in autoimmune disease and in neuroimmunological diseases. And as I said, there were 2 talks already today about susceptibility, genetic susceptibility. We know that environmental exposures contribute to the pathogenesis of these diseases and infectious illnesses. This is a picture of a virus that can sometimes trigger these events. There's been a lot of attention paid to vaccination as a trigger for immunological disease. I'm not up here to talk about problems associated with vaccines. They are incredibly safe and important public health tools, but there are examples of vaccines that very, very rarely can trigger abnormal immune responses that lead to disease, even though in the vast, vast majority of cases they induce a protective immunity. So there are things that you can become exposed to that trigger these disorders, and there's going to be, as I said, a whole session on susceptibility and triggering going on across the wall here. The other place where a lot of research has been focused and a lot of progress is being made is the actual mechanisms down at the level of the interactions between the brain and the nervous system and the immune system. So why do the cells of the immune system, mostly the white blood cells, get triggered in a way that's abnormal to attack the nervous system tissues? And so these triggering mechanisms are the focus of a lot of laboratories' research. And then the next thing that's got to happen is these white blood cells that float around in our circulation have to actually get inside the nervous system where they don't ordinarily go, and they have to cross a structure called the blood-brain barrier in order to get inside the brain, get inside the spinal cord to exert their detrimental effects. And there's a lot of research now looking at the molecular mechanisms of how the blood cells get across the blood-brain barrier and get inside the nervous system. And that's an important area of research because it's a very important target of drug therapy. So if we can block the influx of the white blood cells into the nervous system, that may turn out to be a very effective way to prevent these diseases or to treat them once they develop. Nevertheless, we haven't fully achieved that, and so when the white blood cells get inside the nervous system, and this is an example of that, how do they damage the cells of the nervous systems, the neurons, the cells that make myelin, the oligodendrocytes? And can we understand the molecular underpinnings of that damage, again, as a way to try to target that process or those processes from the standpoint of treatment? And then what we want to know is how can we turn these things off in a selective way as a treatment approach. So disease mechanisms are really an important area of research, and there's going to be a lot of discussion in the scientific sessions about this. I mentioned earlier that another place where a lot of progress has been made are new diagnostic methods. And in particular, I want to just show you some pretty pictures from the standpoint of imaging. You probably all are familiar with the MRI scan, which has been a diagnostic tool for clinicians for now some 20, 25 years. But that technology is not static. It's like your home computer. It goes out of date every other year, and you got to upgrade to the next technology. And so these are some examples of cutting-edge MRI techniques. So these methodologies, magnetic transfer imaging and diffusion tensor imaging, allow us to map out the actual nerve pathways in the brain. Magnetic resonance spectroscopy is also another MRI technique that allows us to study the biochemistry of the brain. So here's an MRI picture with different parts of the brain highlighted, and then the spectroscopy tells us about what's going on at the level of the biochemical reactions inside the brain in these areas. And you can see that in region C, that looks different on the scan than region A, that the spectroscopy is different here. And the details aren't important. The point is that the technology is advancing at a very rapid rate to tell us about these diseases and help us to diagnose these diseases. And this is, I keep pushing the wrong button, sorry. This is a retinal scan. It's a sort of a Star Trek kind of thing. And oculocoherence tomography is a new method to measure nerve fibers in the eye, in the retina. And it is going to, I think, become a very powerful tool to help us track how our treatments work. And in particular, treatments targeting the nerves and protecting them will, I think, be measured using techniques like this. And this is a technology that's brand new and just coming in to the clinic. So diagnostic methods are really moving forward at a rapid pace and really assisting us those of us that are clinicians in helping to diagnose and manage these diseases. So treatments are also moving forward, and you're going to hear a lot about treatment strategies, I think, tomorrow, and there's going to be a lot about treatments in the scientific sessions as well. So plasmapheresis and various immune-suppressing medications are some of our mainstay. But this is our friend and foe, the antibody molecule, which is a protein that are made by the immune system. Some of these antibodies actually cause neurological and neuroimmunological diseases, and you'll hear about some of those antibody-mediated diseases later today. But we've actually been able to harness antibodies as treatments. And so there's a lot of excitement about using the very precise, specific interactions that antibodies exert to selectively target parts of the immune system while leaving the rest of it alone. So they're very important therapeutic tools now. And these green things down here are our friends, the stem cells. And so there's going to be a lot of discussion about cell-based reparative and regenerative treatments in neuroimmunological diseases. So the therapy part of this process is moving forward in parallel with the molecular understanding of these diseases. So I want to wrap up, and I'm on time, to say that I think we're past the stage where we're just simply describing and categorizing these diseases. We know a lot about them. And the new research is really moving into studying the molecular mechanisms of these diseases and developing specific therapies so we don't have to use that sledgehammer treatment of the immune system that carries so much more risk. And knowing the things that are both intrinsic and extrinsic that make us susceptible to these diseases really makes the concept of prevention something we can talk about. And I don't think in previous symposia we really talked about how we can prevent these things. And so as we understand susceptibility factors, that really becomes something that is on the table as the ultimate form of treatment. So I'm going to wrap up. And again, thank you for your attention. Thank you for coming. And I want to reemphasize that point I made to you at the beginning. As you see the scientists, you see the clinicians walking around in the hallways, go up to them, talk to them, interact with them, and I think that's the thing that's going to make this whole symposia unique and the most rewarding for all of us. So thank you very much.